bring in Dr. McCormilla this morning. Did I say that correctly?
You said it correct.
Oh, awesome. Perfect. So you're an oncologist at Arizona Oncology. And tell us a little bit about kind of how important it is for people to really stay on top of their own health year round and check themselves regularly or go to the doctor regularly all the time.
See, I think prevention is the most important key here.
Mm-hmm.
I mean, you can do that by screening. That's what we recommend for most of our patients. So the key here is if you can do screening, you can identify cancers pretty early in life, and then that gives you more treatment options, less aggressive treatments, live longer, have a survival benefit, and possibly a cure. That's why we say prevention and early detection are the key.
No, I think when it comes to cancer, we think about specifically with women, you have to go and get a mammogram for breast cancer, cervical cancer, that's something that's detected through a pap. So there's all these different tests that you have to get, and it can be overwhelming. Are those things that you can see just, maybe taking somebody's blood, some of the indicators that cancer would be there? Do people have to go and get all these different tests, or would one test really kind of show if there's something wrong in your body?
That's a good question, but still, I think there are some blood tests, but still the traditional, like you mentioned about the mammogram, annual mammograms for women are still the standard of care starting at age 50. I mean, now we are doing screening more in the 40 to 49 age women, because especially if they're high risk, and 50 to 75, we still screen them. The tests that you're talking about, some of them I would say, like the Cologuard, it's called multi-DNA stool testing, where they do it once every year or once in 2 or 3 years, and then, but that's not a substitute for a colonoscopy. Still, colonoscopy is the standard of care for men starting at 45, or men and women starting at 45 and up to 75. And coming to the other screening about the cervical cancer, still, I mean, there are now much better tests than before, like the primary HPV testing done every 5 years, starting age 25 to 65. That's a standard of care. So these are still the standard of care from the testing standpoint.
So what are the top, would you say, let's say five, most common cancers that you're seeing that people are getting just across the nation?
See, typically, the most common cancers, I would say, breast cancer in women, prostate cancer in men, lung cancer, colorectal cancer, and skin cancers. Skin cancers are really a lot, but that's seen mostly by dermatology. But the rest, like breast, colorectal, prostate, and lung, that's our majority of the cancer patients, I would say, in our practice. And in matter of any oncology practice, that's the most common seen cancers.
Now, when it comes to cancer trends, I know me and Carson have talked about this, because I know somebody personally who's 26 and was just diagnosed with breast cancer. And we've talked about how it kind of seems like younger people, and maybe it's just that we're growing up, so we're more exposed to it now. But it seems like kind of younger people are being diagnosed with cancers more prevalently than they used to be. Is that a trend that you're seeing?
We are. Cancer is traditionally a disease of the old, but lately we've been seeing much more cancers in the younger population. I would say my youngest breast cancer patient is 22. So that's that's so early in life, and my cancer patients are breast cancer, I would say 22 to 94. That's the spectrum of breast cancer I see. But we are seeing a more trend, probably, I would say maybe some of that could be related to the lifestyle, what we are right now.
Yeah.
And probably, there are definitely cancers are preventable. Many cancers are preventable, I would say, and by avoiding some risk factors like tobacco use, excessive alcohol use, then obesity, being physically active, and then one of the major thing is the viral infections like HIV, hepatitis B, hepatitis C, HPV. These are all the viral infections that can cause cancers. So if we have that basic, if we could take care of the lifestyle changes, I think that will have a tremendous impact on the decreasing the rates of cancer.
How about for young individuals, would you recommend genetic testing if there's certain histories in your family of cancer?
Yeah, that's a very good question. So we do offer that. I mean, we don't offer to everyone, but there are certain high risk individuals that we look for. As you said, someone having a cancer in their early part of their life, in their 30s, 40s, sometimes 20s, those are high risk individuals. or someone having multiple family members with cancers, like someone has a prostate cancer, pancreatic cancer, breast cancer, colon cancer. So someone having multiple cancers in the family, they are high risk. So you do genetic testing in those people who are at high risk, or the same person having two different cancers, that's a high risk. Or like a men having breast cancer, that's also puts them at high risk. So all these people who are at high risk, we recommend genetic counseling. We have a genetic counselor, we do refer them, so they get appropriate testing and it's interpreted appropriately, and so the whole family is taken care of. And the key is again early detection. So these people are screened much earlier in their life compared to the other people who are more screened at age 50, 45. These people can be screened almost at age 25. So we start screening very early in their life.
So for the genetic testing, would it work like, I have two sisters. Our grandma passed away from breast cancer. We also have bladder cancer, melanoma in our family. So if I got that genetic test done, would my sisters then be covered? It would kind of determine their risk as well?
Yeah, what typically the genetic counselor do is they bring in the whole family.
Okay.
So they do a chart, like the family tree. They draw that and see who is at risk, the first degree, the family members who can be involved, and these are the people, they all get tested. So that's why going through a genetic counseling, a proper channel will test everyone and put them at ease. If they don't carry that mutation, then I think they have average risk. They're not at high risk.
Okay,
Wow.
that's cool, yeah.
Well, thank you so much.
Thanks for having me here.
Is there anything else that you want people to know for Cancer Prevention Month?
As I said, preventing cancer is by decreasing the risk factors, and then early detection is the key. These are the key things that I encourage everyone to be on top of things. Proactive screening, I would say, is the key.
Absolutely. Thank you so
Thank
much.
you
We
so much.
appreciate it.